Hello everyone, welcome back to my channel. My name is Janae if you're new, and welcome to a new video. So on today's video, I'm going to be letting you guys know what it is I do at work and how it's going to benefit me as a nurse. So if you're interested to see what it is I do and how I'm going to optimize on my skill set so that I can become a better nurse and help pass nursing school, then just keep on watching. So, as you can see, I am in the ER. I am currently a patient care tech working in the emergency room. So to shorten it, I am an ER tech. So this is my second time working in the emergency services field. I was an EMT for 2 years on a 911 ambulance service, went through paramedic school, so I am definitely not new to the emergency services side, but I am new to the hospital side and being a patient care tech. So I started working as a patient care tech back in late August, right before school started, and it's almost about to be 6 months for me, and I have done so much so far. So to get a job as an ER patient care tech, there's not a lot of requirements that are different from the PCTs, regular PCTs, but I think an advantage for me was the fact that I did have 2 years of emergency services experience. All I needed for my job was to have a BLS. So now that I do have my job, I do need to get ACLS certified, which is what I'm currently doing right now. I'm not 100% sure about PALS. I need to actually verify that with my manager because we do have children who come in the ER, but I know for sure I need to get ACLS certified. So what do I do as an ER PCT, and what's the difference between an ER PCT and a floor PCT? So at my hospital specifically, ER PCTs get to do a lot more skills compared to the floor PCTs. So it's the emergency room. It's not a lot of hands-on direct patient care, bedside patient care like the floor is. I mean, it's always revolving as far as the patients is concerned, and one is the emergency room, so it's more emergent. So they need people to have more of a skill set to get things done, unlike the floor techs who get vitals, help with assisting patients and so on and so forth. So as far as what I get to do in the ER, I mainly work in the front triage area where our walk-ins come in. I recept the patients, take down what it is that they're coming in for, let my nurses know. With that, I am collecting a urine sample or stool sample if we need it. I am obtaining vital signs. I am hooking them up to the EKG and getting that 12 lead started and showing that to the doctor. I am getting IVs and I am collecting my own blood samples. Along with blood samples, I'm also getting my own throat and nasal samples for COVID, strep, and flu swabs. I actually do a lot. And my patients, when they're there with me and they see me bouncing around, they're like, "You do a lot of things." And I'm like, yeah, I pretty much do it all. Getting that process started for the patients. I also get to use the bladder scanner if a patient is coming in with urine retention. If we have a pediatric coming in, I'm obtaining their height and weight and getting their rectal temperature if that's what they're coming in for, along with IVs on the peds as well. I participate in any codes that is happening. Whatever the situation may be, I do my part. Another thing I get to do is ultrasound IVs once I am trained and signed off on that, which I think is so cool, to use the ultrasound machine to find an IV. Instead of having to call the PIC team, if I do become a floor nurse, I will know how to use the ultrasound machine once I am trained on it. So another thing I think is so cool and will benefit me later on. And the last thing I get to do as an ER tech is splints. And that's if someone is coming in with a broken bone or whatever, and they're not getting the surgery right then and there, but it needs to be stabilized, I am the one to wrap that up and start their splint and establish their splints. So a lot of things that I get to do as an ER tech is so skill heavy, and I love that. And that is pretty much it as far as what I get to do. And it is a lot. I'm doing that repeatedly all night long. And I was so happy to get this job as an ER tech just because I knew it was skills heavy. So no matter where I go as a nurse and whatever department I want to pursue, I have this strong background as an ER tech. So I can do my own IVs and I can collect my own EKG. Like, I can do all these things and I won't have to rely on someone else, because you'll be surprised on how many nurses don't know how to get an IV or can't get one, or is a little insecure about getting one. Trust me, they call us from the floors to get their IVs, and they normally send us because we're doing them all night. So I see it happening. So I'm glad that I will have a strong foundation on doing my own things. So as far as my hospital is concerned, what I like about it is we're on the smaller side just because there's like a million hospitals here in San Antonio. So we're a level 3 trauma center, but we're also still on the smaller side, at least compared to other ERs that I have been to. It's on the smaller side. So there's a lot more connection with my nurses and my doctors. And if there is something going on with a patient, I get to ask the nurse, or I get to ask the doctor one-on-one, like, hey, can you talk to me about this? And what was your thought process? And I get to hear those interview questions that the nurses and the doctors are doing, and seeing, kind of what it is that they are asking about, and seeing where their mind is going as far as what they think it can be. I get to see the patient's workup, so I get to see their x-rays and their ultrasounds and their lab results, and start to piece those things together. As I become a nurse, it's not so new to me. So I plan on keeping this job at least for the next 2 to 3 years as I'm in nursing school. Once I start to really narrow down what department I want to work at, maybe I'll put in a transfer to go somewhere else, to get that experience in that specific department if I can, and make those connections and all that stuff. But for now, I'm comfortable in the ER. So because I have the experience on both sides of the spectrum as far as seeing a patient on the street and seeing a patient on a hospital, let me just briefly talk to you about the differences between ambulance life and emergency room in the hospital life. So something I had to wrap my head around was that I am no longer doing my own assessments. What I mean by that is, when you work on a truck, is you and your paramedic partner, you are seeing the patient for the first time. You are the one who's having that first initial contact with them, and you're going based off of that, you're treating that, and you're getting them to the hospital. We're not just ambulance drivers, we're actually treating people. And that is something I had to wrap my head around. I'm literally just working them up and sending them on their way when I'm in the hospital. But outside the hospital, it's a lot of activating things and reporting that back to the hospital, giving report to the nurses and the doctors, especially if it's a critical situation, and them relying on us because we were the first ones to see the patient in the condition where they were at. Now, of course, if there is something that's going on with the patient that I notice, I will report that to the nurse and the doctor. Or if there is something specific that a person will tell me, because the nurses and the doctors have their own questions, but I'm the one that's having the longer contact with them, and they're just talking to me and they're telling me everything, and there might be a piece of information that they didn't say to the nurse and the doctor that they told to me, so I'll let them know that. Another thing that's a difference between the two is that I don't have to write my own charts. I don't have to write no reports, and I am not mad at that. I'm telling you, every chart we had to do in EMS, whether it was BLS or ALS, there was still some type of written form that had to get done. I don't think anyone likes charting, but of course you have to cover yourself. Whereas when I'm in the ER, I don't do charts. I might like document something, like document vitals, or put in a patient note or something like that, but I am not writing out a whole report, I'm not doing that. So I'm cool with that for the next few years. Another big difference between being on the truck and in the hospital is the equipment you have, especially when it comes to codes. So when you're on the truck, it's you, your partner, you have your monitor, you have your jump bag, and you go. And of course, it has everything that you need to help a patient in a critical situation to sustain life until they get to the hospital. And then of course you have your additional resources that you can call, whether that is PD, whether that's the fire department, or your lead medics or supervisors. At least that's how my service worked. Whereas in the hospital, you have a bunch of nurses and a bunch of doctors and the different departments coming down, and all the special equipment and the Lucas machine and the this and that, and it can become a lot sometimes. Like, obviously I get the purpose of it all, but when you're on both sides, it can become a lot. So all in all, before I actually become a nurse and as I'm going through nursing school, I will have about 5 years of healthcare experience through my job as a CNA, phlebotomist, EMT, paramedic, and now ER tech. And I was a PCA for a little bit on the floor of a different hospital when I first came to San Antonio. It was of the PCU unit, and I did not like it at all. So I'm so thankful I got the ER tech position, but that's how I know that the skill set is different from floor PCTs and ER PCTs. But that is it, you guys. I just wanted to let you guys know what it is that I do for work and how it's going to help me as far as becoming a nurse. If you have any questions or want to see any content as far as work is concerned from me, go ahead and throw it in the comments below. If you enjoyed this video, make sure you give it a big thumbs up, subscribe if you haven't already, and hit that bell icon. That way you're notified every single time I post a new video. I do post a lot of content on my Instagram and my TikTok, so I'll go ahead and throw my handles right here for you guys if you want to see like little work vlogs or days in my life or anything like that. I'll do some of that on YouTube, but it won't be as full because of course I can't be recording a whole bunch in the ER. Thank you guys so much for watching, and I'll see you next time. Bye bye.